Ah! Mtajuaje HOP grow? Welcome to another set. We have a different set. This is In Between Briefs. My name is Vieira of House of Panache. And on this episode, we'll be talking about Gold Star. Yep. See you soon. Karibu tena kwenye jukwaa la In Between Briefs. In Between Briefs is a show by House of Panache where we take a break from doing campaigns. In Between Briefs is like, kama hauko job, you say you're in between jobs. Us guys, we know, we are sure there's another brief coming. How have you been? I hope you've been enjoying our series. This season we're talking about documentaries and why our desire to tell stories now have gone beyond the 30-second ads that we do and the 360 campaigns we do. Now we are doing theater, we are doing community theater, that is, we're doing documentaries. And this week's documentary is by a client we really like. When we did the FGM campaign, we met an amazing doctor called Dr. Vanon Moache. He's the director of Gold Star Kenya. He gave us a brief. And one thing we know is that some stories are bigger than campaigns. They're about life itself. With Gold Star Kenya, we told a story of Afia Uzazi Salama. Hata jina tu inakwambia wanafanya nini. It opened in a dim hospital corridor, a stark reminder that before 90-second passes, a mother or a child somewhere could die from pregnancy complication. Remember at House of Panache, idea zetu ni za watu na utu. Na everything, it's not just about mass communication, it's mass communication about what? In every 90 seconds, kuna mama ama mtoto fulani akizaliwa atakufa. But this wasn't just about problems, it was about solutions. It was about hope. We followed doctors, nurses, and community health workers who believe that even one preventable death is one too many. We heard from mothers like Joy, utamuona kwa documentary, who carried her pregnancy safely because she had access to care. We saw the power of local heroes, community health workers going door to door, vaccination being given, and lives being saved. The result? Over 50,000 mothers reached prenatal care, safe deliveries, and child immunization. And more than numbers, it was dignity restored, futures protected, and community standing stronger together. This is why we tell the stories the way we do. Mazeja nikwambia, it's one thing to win Makans, Maluris, and everything, but our desire is a small creative community called the HOP, is that our stories are impacting the society. Now, let me tell you something. With Afia Uzazi Salama, we saw the real MVPs. Community health workers changing lives daily. This documentary wasn't just about telling stories, it was about honoring heroes, capturing resilience, and showing impact. When stories like this are told, they don't just inform, they inspire. Check it out.
Every woman deserves access to quality, respectful, and equitable maternity care. That belief is at the core of Gold Star Kenya.
My name is Dr. Vanon Moache, and I'm the Executive Director of Gold Star Kenya, an indigenous non-governmental organization whose mission is to empower Kenyan communities for better health. Our interventions aim at galvanizing community action to promote the adoption of healthy behaviors while responding to the unique ways of life of the communities that we serve.
Through our Afia Uzazi and Afia Uzazi Salama projects, we've reached over 50,000 pregnant women, providing prenatal care, skilled birth attendance, postnatal support, and childhood immunizations.
These projects aimed to improve the health of women and their children in this predominantly rural Kenyan setting, leveraging our community-driven interventions to create and drive demand for women and child health services.
Those messages zenye mnatutumia sometimes inatukumbusha hata tuendange clinic.
Kujifungua pia nilienda hospitali, sikujifungua kwa nyumbani. So nashukuru kwa sababu kama hawangekuwa yeye singejua.
Mimi kama CHW wa kijiji yangu Kimuku nafurahia kuona kijiji yangu imebadilika.
With your support, Gold Star Kenya would like to scale up our tried and tested interventions to incorporate more community health units, more Kenyan counties, and to involve more community-owned resource persons.
Let me tell you, this story is connected to USAID. and how USAID affects everyone in Kenya. Everyone.
We have closed the USAID group to eliminate waste, fraud, and abuse, which was tremendous waste, fraud, and abuse. And we're working tirelessly to forge new economic opportunities involving both the United States and many African nations.
But when President Trump with his ilikuwa inaitwa Doge ya Elon Musk, walikata USAID, wakasema hii kitu is useless, is a money waster, is a nini. For most of us, me included, were like, okay, fungeni hii kitu hata sijui inasaidia nani. We didn't know that some of our clients pay us through USAID money.
So from around 2016, Gold Star Kenya has worked with funding from the United States Agency for International Development in Baringo County to implement the Afia Uzazi program, which is basically good reproductive health. You know, we did this as a sub-recipient to FHI, Family Health International, up to 2019. And then after that, we were funded by Safaricom Foundation to implement a follow-on project as the prime, called the Afia Uzazi Salama. And all these projects focused on, both these projects focused on improving the health and welfare of women and their children.
Again, Mazeani, when we did Afia Uzazi, we didn't just realize how the mortality rate is so high. And for us, Mazee, now we are no longer young creatives. Now we're hoping that our work can impact our communities, and we're working in those communities as hard as we can. That's why we have community theater, that's why we're doing documentaries, things that you cannot, wezi bishana na data, wezi bishana na documentation. That's what we're doing, and we're very, very happy you joined our show today. This has been In Between Briefs. My name is Vieira of House of Panache. If you want to go beyond a 30-second ad and tell stories that wacha hii ya kuzua watu nunua ama mkufe, come to us and we can help build your story through documentary storytelling. See you soon. I love you. God bless you.